it's Hema here from CSA SmartGroup. Welcome to Date with CSA, and I'm more than happy to help you to pass your CSA exam. And today I'm going to talk about a scenario where some of the patients might come for sleeping pill. When I had a coaching with my students recently, I noticed like some of the students are really struggling to address this issue. Some of them, started saying straight away like, sleeping pill, do you mean like diazepam? No, we can't prescribe that, and then the patients will get, the simulator will get angry and then say like, why can't you prescribe? And then we have to explain more. Like this is all happened within second to third minute, and it actually looked like a tug of war from there. And then some patients, some candidates felt a bit difficult to explore a little bit more, so they were like seeing the case like with the hand lens. So I would always recommend like see the case as like a bird's eye view. So as a GP, we not only see what the patient has come for, but we would try to address the root cause, and we would try to make sure we are covering all aspects of his life, like what the support network the patient has got, has the patient has got any other problems like drug misuse, or is he financially independent, or is he suffering from any other disease like, for example, depression or psychiatric conditions. So as a GP, we have the innate quality to look at the patient as a whole human being with their whole living condition. So that's one of the things we have to practice as a GP trainee to finish within 10 minutes as well, because we don't have 30 minutes in CSA, isn't it? So more we practice, more sleeker we will get and more confident we will look. So what I would advise, like when we come across patients like this, even in a real life, it's very important to address them gently and show empathy and acknowledge whatever problems they are going through, and to get a good rapport as early as possible. So more sooner we get their confidence in us, more easy will be the consultation. So I would strongly recommend to get the rapport as early as possible, and then try to be a very positive, supportive GP. Try to be very optimistic, approachable GP, and make sure how your body language is, how your facial expressions are, and what language are we using. These are all have impact on the patient and how they behave during the consultation. So I would advise you to start observing your GP trainers, your program directors, and your senior GPs. You can even role play, you can request them to role play these scenarios to make sure to see how, because of their huge experience, we can learn a lot just by observing them. I would strongly recommend to to do this. And then what I notice, like some of the candidates are quite negative when they say like, no, I can't prescribe diazepam straight away, and the consultation didn't go well. So it's very important, if you have read Roger Neighbor's Inner Consultation, some of the consultation skills books, they might say like, try to be positive. For example, certainly, yes, of course, we can look into it. If it's the best thing to do, I'm more than happy to offer you that, something like that. Rather than trying to be saying no or negative words, it's better to start with the positive, encouraging words. Then try to explore a little bit more about why they want sleeping pill, what's going on, how is their sleeping pattern in detail, how long it's been going on, and what are the measures they have taken, what triggered all those things, and why they think, for example, diazepam might be useful, how they got that idea, what's going on in their mind, and what support network the patient has got, Is he financially independent? Is there any other problems like drug misuse in addition to that? Or is there any history of psychiatric problems like depression? So these are the things we have to make sure to explore more, and we have to be very empathetic. We can say like, you look very shattered. I'm really sorry that you have to go through this. And then we can try to explain that sleeping problem is only a symptom, but we have to find the root cause for the problem. Because as a doctor, it's easy for us to treat the symptoms, but unless we get the root cause, we can't treat the patient as a whole, isn't it? So it's very important to have that point of view, to look into the things more in detail, and help the patients to come to to understand their problem and take measures to solve them. And also, when we say like, if we think that it's okay to give them few days of sleeping tablets, it's very important for us to tell them like why diazepam may not be better choice, or whether we can give them zopiclone or some antihistamines, whatever you think appropriate for the situation. We can tell them, and we have to practice like how we are going to tell them, like we can only give for few days in a short term period, and how we are going to explain about the pros and cons of that, what might be the side effects if they start taking for a longer time, and those adverse effects on them. So we have to start practicing all these scenarios, and then form some form of sentences so that you're comfortable with, and then try to use that in your practice sessions. And I think you'll be fine, and you may find more easier to deal these patients in day-to-day life. And one important advice I heard from one of my trainers, like whenever you come across demanding patients or angry patients, he told me like, never be like a sponge, okay? Because sponge, it will absorb whatever water it come across. He will say like, don't absorb his angry or his frustration or the demanding nature. Don't take it too personal. Just be like a mirror and reflect back. And that helped me a lot, because then as soon as I realized that I won't get panicky, when I think this happened in my A&E. So whenever I come across the shouting angry patients, I can say like, I can see you're angry and frustrated, but I'm here to help you. If you calm down, I will be able to help you in the best way. Something like that, simple. So just reflecting back like a mirror, whatever you're seeing, it helps you to calm ourselves down, and our mind will be in a better position to think the best solution. So I would advise that. So scenarios like this, friends asking for diazepam or asking for any specific kind of miracle pill, just explore a little bit more about that, why they think that is suitable, what information they know about that, and what other situations, what is the root cause for the symptoms rather than treating the symptom. So if you start practicing like this, you not only pass your CSA with flying colors, but your patients will love you for this, I'm sure. And it is happening in my life. I enjoy treating patients with psychiatric problems and drug misuse problems, simply because I see them as humans, and I look into the root cause rather than superficially addressing. And it will give a sense of satisfaction as well, when you treat and make a fellow human being better to lead their life as normal and as comfortable as possible. You can see the sense of happiness and satisfaction in yourself. So this is the right time, friends. So pick up the scenarios like this, start practicing with your trainers and your colleagues, and shine. That's it. Goodbye from CSA SmartGroup and Hema. Till we meet again in the next Date with CSA video. Bye-bye. See you.